Hi, today I'm going to speak to you about the mechanisms of pain. Now, many patients come to me because they have chronic pain. So it's a very complicated thing, and so we're going to speak about some of the different mechanisms. Quite frequently, patients have multiple mechanisms, and some of these mechanisms actually overlap with each other. So we're going to talk about them right now. And so if you suffer from chronic pain, or if you know people that suffer from chronic pain, consider the different mechanisms, because if you want to alleviate these symptoms, you have to go after the cause. So one of the causes is insomnia. And so what is insomnia? It's where people sleep less than 6 hours per night, and usually they wake up multiple times. It's okay to wake up once in the middle of the night. Sometimes they say that twice is even okay, but if you wake up more than that, it's too many times. And so if that's the case, you will not be getting restful sleep, and if you don't get restful sleep, then your body doesn't heal. And so you have to look at why do you have insomnia, and then we're going to do lectures on this in the future, but how can you start to make it so that you actually sleep so you can get restful sleep. The second thing I'm going to talk about is emotional pain. So sometimes something very traumatic will happen in your life, and it will affect you emotionally. And so sometimes people get what's called a limbic escape, where all of a sudden they just start crying, or all of a sudden they just start screaming or yelling. These kinds of things are limbic. And so the frontal lobe has to be able to inhibit the limbic lobe, but if it can't, then you get these mechanisms, and they relate back to emotional experiences. And now there's in the limbic lobe, there's an area that acupuncturists target called the insular cortex, but this area has a viscerotopic map, so it has maps of the organs, and it also has a somatotopic map of different parts of the body. So acupuncture actually helps this. There's a technique called neuroemotional technique that helps this, but ultimately you have to actually address the frontal lobe if you want to help patients with this problem. So the next thing I'm going to talk about are the neurotransmitters of the brain. There's many of them, but certain ones are linked to depression, and they're linked to chronic pain. So those are dopamine and serotonin. Now, dopamine is one of those ones that around here, lots of people don't have enough dopamine because we don't have enough vitamin D. But also blood sugar issues can affect it, as well as any kind of anemias and calcium deficiencies and things like that. But both of these are, so we see depression and chronic pain with these two neurotransmitters if you don't have enough of these and you can't synthesize them. So there are things that we can do to change that, and in the future I'll be doing some lectures on the different neurotransmitters and the biochemistry of those. So also I'll talk to you about, it's possible to have a pinched nerve that creates pain. In that case, you have to figure out where is the pinched nerve, and you have to take pressure off the nerve and allow the body to start healing. But a very common one that we see is neuroinflammation. So understand that there's a map of different body parts, and if those areas of the brain are inflamed, you will get chronic pain. Also, though, I'll mention another thing. If the brain is atrophied, where different body parts are represented, that will also create chronic pain. If you have, let's talk about neuroinflammation a little bit more. So one thing that we see commonly is when people have digestive problems. This can cause neuroinflammation. So if you have chronic constipation or chronic diarrhea or intermittent diarrhea and constipation, this can cause neuroinflammation, and this can create chronic pain. If you get any kind of concussion or traumatic brain injury, this will create neuroinflammation, and this can cause chronic pain. If you have an open blood-brain barrier, we can actually measure this, and this is a sign of neuroinflammation. This is called an S100B. This goes to the Mayo Clinic. This is a blood test. Sometimes, also I should say that when people are born, so for autistic children, they're all born with an inflamed brain. So lots of times they're going to have, pain, and that's because of neuroinflammation. There's a lot we can do for neuroinflammation for all patients. So patients that are autistic, we can go after that neuroinflammation. There's also immune reasons why people have chronic pain. So when we're dealing with autoimmune disease, we have to ask ourselves what tissues are actually being attacked. It's possible that tissues will be getting attacked from your own body because your immune system is confused, and sometimes this creates pain. If you have infections, that can create pain, and sometimes infections are chronic. Also, cancer also can create pain. So, but not always. Many people have cancer and they don't have any pain at all. Now, one thing that I see every day in my practice is people that have systemic inflammation. Systemic means that it's all of your body that's inflamed. And we can see this in blood work. So when we're looking at blood work, we look at C-reactive protein, we look at ferritin, we look at erythrocyte sedimentation rate. And if these things are elevated, we know that you have systemic inflammation. And if you have systemic inflammation, you have to get on an anti-inflammatory diet. And most people in America have a pro-inflammatory diet, so this is why I see this all the time. Another thing that can give you chronic pain is if you have an injury. So understand that, say that you injure your shoulder, that has a representation in your brain. So if you injure your shoulder, you're not going to get normal information to the part of your brain that represents that body part. And so in time, that will make that body part atrophy. It'll make the brain atrophy, as there's miscommunication between the body part and the brain. So this will cause chronic pain. And so what we have to do is figure out what exact tissues are injured so that we can fix the injury, and then we do things to exercise that part of the brain as well, and then this can go away. Another thing that can create chronic pain is when the sympathetic nervous system is in dominance. So what do I mean by that? That means if you have high blood pressure or high pulse and back to sleep again, if you're not sleeping much and you're not digesting well, this can create sympathetic pain where your body's in fight-flight dominance and you're not able to rest and digest. This can create some really interesting pain syndromes like reflex sympathetic dystrophy, where you're not getting enough circulation into certain parts of your body, and then the body parts will become red and swollen and kind of shiny looking. And I've seen these things go away, but you have to work on getting your body out of fight-flight dominance and into rest and digest. So those are the mechanisms of pain. I will catch you next week and we'll talk about some more stuff.